Everyone, I'm Karen Busse, and I am the Director of Continuing Medical Education for Norton Healthcare. Today, I'm going to talk about creating a podcast and some of the key steps. If you've wondered about a podcast as a learning format and didn't know how popular podcasts are, there is a study that was conducted last year, and it indicated that for individuals 12 and over, 47% do listen to podcasts monthly. So not only being an enduring activity that is easily accessible 24/7, podcast is a popular format. Also with the podcast, it's audio learning. So what this does is it allows the learner to be any place. They don't have to be at a dedicated spot, sitting at their desk, at a computer or conference room. And another study indicated that 49% of people do listen to a podcast when they're doing household chores, 42% when they commute, and 29% when they are working out. So definitely a format that goes to where the learners are. So this morning or afternoon, depending on where you are, if I can change the slide, we're going to review some of the key steps in planning a podcast, and then I'll also provide some tips for incorporating the accreditation guidelines. I'm going to be reviewing more global and big picture. So a little bit about Norton Healthcare. We are located in Louisville, Kentucky. We're an adult and pediatric provider, and we also do tertiary services. We have 5 hospitals in Louisville and 3 in Southern Indiana. We have over 22,000 employees, of which about 3,000 are physicians and advanced providers. In respect to CME, we are accredited by the Kentucky Medical Association, and this is just a highlight of our activities for 2023, of which you can see for enduring activities, 50 last year were podcasts. So we launched our podcast in April 2019, and since that time through the end of July, we've had over 35,000 downloads. We are international, and 13% of our listeners are from overseas and 87% in the US. And you can see our top countries here. And interestingly, only 31% of our US listeners are from Kentucky. And these are our top 3 topics. We've had about 70 that have been launched since we went live in April 2019. And these are the top 3. So now you're wondering, do I do a podcast or not? How easy is it to plan? Well, with anything, I'm guessing you've probably had providers come to you and say, hey, let's do a podcast, and you're not really sure, or you just want to jump right in. So some of the pre-planning steps with anything is the why. What is your objective? Are you going to be providing continuing medical education, and this is a learner format, or is it just going to be informational? Then you want to look at your target audience. Is it going to be physicians? Is it going to be advanced providers? Who are you targeting the information for? And if it's informational only, are you going to target both physicians or providers and consumers? And that helps determine what types of credits you're going to provide, educational credits. And then the how. Is your podcast going to be a monologue, or is it going to be a dialogue with guest and a host? Are you going to have a single host for every podcast, or do you want a host that is relevant to the topic, or maybe a pediatrician if it's pediatric topic? So you kind of look at who you will have as your host. And then also you want to look at the frequency of your podcast. Is it going to be monthly, every other month? Is it just going to be a dedicated series? So those are some of the key questions you want to answer. So as we look at MedChat, I will answer those questions for you. Our audience and our purpose is mainly to provide evidence-based education. So we do provide both CME and ANCC for our podcast. And we kind of tag it as CME on the go. Our target audience is primary care physicians and advanced providers. And in respect to that, we address both adult and pediatric topics. So we're addressing those specialties of primary care providers. For our podcast, it's a conversation. We do have a moderator and a guest. Every now and then we'll have more than one guest, but we find it works better if it's a single guest rather than multiple. And we also have multiple hosts. So depending on the topic or where we're recording, we may use a pediatrician, we may use an internist. 90% of our podcast hosts are physicians. And then in some cases, we do work with our advanced provider team, and they also will moderate. MedChat is launched monthly. It's the second week of each month. The next, this is kind of the fun, is the branding of your podcast. Before we get started, I pulled a few podcasts, and we don't really have the chat capability, but this one is obvious as you see this. Podcast is for individuals 40 and over, and it's a health and wellness podcast, nutrition, diet, exercise. This next one called The Deck, it could be, when I first saw it, I thought it had to do with gambling, playing poker, card games, different stories related casinos, but actually it is a crime podcast. So law enforcement agencies create decks of cards for prisoners, and on the decks of cards are cold cases. So it's individuals that have been murdered or individuals that are missing. And the hope is that the prisoners will recognize someone and provide a tip. So this podcast is about cold cases. So some of the key things as you're considering the name for your podcast is, who is your audience? You want to keep it short and sweet. You don't want to get too cute, kind of keep it simple. You don't need the word podcast in your podcast, in that people are searching for a podcast on a podcast app. So it's kind of redundant. So simply keep it simple, not too cute, and you do want to make it memorable. I went ahead, we did not have AI when we created our podcast. So I did try AI to see what kind of names they would come up with, and you can see the prompts here. Short name, who our target audience was, and what the content is. And these are some of the names that AI suggested. And again, with AI, you just have a conversation. If you don't like something, you ask for them to give you more and provide additional prompts. Next is your logo. So you do have limited space. It essentially is a square. So you have a small square, and when people search, they all line up. So you want to have a design that is simple, that fits well in that square. Contrasted colors, look at how your font is being used. You also want to think of additional uses, and then I would just have the sizing reapplied for your additional uses, such as social media or different things like that. Again, you do want to make it memorable. So let's go back to MedChat. So for our name, again, I mentioned we did not have AI, so we kind of brainstormed among our team, and then we tested it out. So this is a name that one of my team members came up with. So med, in that we're clinical and medical content. We use the word chat in that our format is more informal, and it's a conversation, discussion. So this kind of represented that. At the time, Norton had a branding campaign called Look for the N. So we have the N on there. We don't have our name on our logo at all, though you can see it's Norton Healthcare in the show notes. And a stethoscope. Everyone thinks of stethoscopes for medical. I am going to play a video.
You're listening to Norton Healthcare's MedChat, the podcast that provides evidence-based education programs for physicians and other providers on the go.
So So once you anything with planning, I always joke, it's like macro to micro. So now you're getting a little bit more micro, and in the pre-planning, you need to create your calendar. What are you going to talk about? What are your episodes? Who is your guest or guest, as well as your moderator? A few things that we do, we try not to always reinvent the wheel. So if we have a real good speaker for a live program and we feel that the presentation would lend itself to audio learning, or there's more that we want to delve into, we'll go ahead and ask the speaker if they would be willing to do a podcast. The one thing we never do is a live program or live stream program recorded and just reformat it for a podcast. It's always produced specifically for a podcast. Another thing that we've done is if we want to address additional aspects of a topic. So for example, we did a series on human trafficking, looking for the warning signs, resources, what to do. So that was a podcast. And then we had a human trafficking survivor, and she agreed to do a podcast for us. And it worked really well because she was able to tell her story and remain anonymous for a podcast. So there's some uses for a podcast that would not work for a live stream. Also with the podcast, as you can see, our audience was a little bit different. So you're not targeting the exact same people that would attend a live program. So that's why the duplication of topics and stuff seems to work well. This is CME and educational. So a key thing is it does need to address a gap. So we do a planning form for all our podcasts, literature search, and there's disclosures and mitigation for our host, our speaker, and our planners. We then create a discussion guide, and I'll address some of the key points of that. One of the key things is it's informal content. So it's a discussion guide. We do not script our podcast at all, so it is definitely not scripted. This is where I say the magic happens in the recording and editing. We have ours professionally produced by a podcast engineer, and it's great. So they can take out the person's ums and so's, all those filler words. Also, if they discuss something we don't want on the podcast, for example, we had a physician talking about pediatric hypertension and pediatric obesity kind of resulting in that. And then they mention it's so easy for parents just to drive through McDonald's and get fast food. Well, we didn't want that on our podcast, so we asked them to restate it, talking just about fast food and the effects on pediatric obesity and not talking about McDonald's. So when it is recorded, it is recommended that you have someone sitting in there specifically listening for this type of stuff. And then that way you kind of work with the podcast engineer and give them a listing of what needs to be edited. Then it is produced and launched. So here is an example of our calendar. We try to do our calendar 3 to 6 months in advance, and we always try to record them out so we kind of have a series ready to launch. Again, ours is once a month. And this is an example of a discussion guide, and this is done for every podcast, and I want to highlight certain things. We do ask the speaker if the information would be good for 2 or 3 years, or in some cases, we did a couple COVID ones and they were online for 6 months only. We remind the speaker who the target audience is and that it's continuing medical education, to use generic names only. We also remind them that these are general discussion questions, that it's not scripted, so the moderator may delve into other topics. So it doesn't matter if all these key points are addressed or not. And then we also let them know and remind them, you are not talking to people in Louisville, Kentucky, and potentially not in the US. So everything is not specific to Norton Healthcare in Louisville. It is essentially evidence-based clinical information. So here is an example of the discussion guide. As I said, it's just a template. What we do with the speaker before we record each program is we ask them if there's any key points. We also have a question at the end that asks if there's any more information they would like to address. And now let's listen to a podcast on substance abuse, actually a minute of it.
Their life may be spiraling.
Yeah.
And if they don't have a door to go into 3 months down the road, 6 months down the road, that could be life and death for them. So, trying not to close that door on patients is important.
I imagine if I'm a busy clinician and I've tried everything and I've reached the point where I really think an opiate is appropriate, I imagine that there are a host of ways that might be used. It may be for a short course. It may be for more of a chronic course. Is that true?
Yes.
Is it more often than not going to be part of a chronic treatment regimen, do you think?
So that was just an example of one of our podcasts with the discussion. In respect to some budget and technical aspects, as I mentioned, we do have a podcast engineer that we work with, and everything is turnkey for us. In the recording of the podcast, we have equipment to record it. I work with someone from our media team that does record it, and we essentially go to where the provider is. So we try to go to conference rooms rather than their office, and that there's too much hallway chatter. So we have quiet areas on our campus where we will record the podcast. Each episode for us is about 300 to 400 to record, and the platform is about $20 a month. And for those that aren't familiar with what a platform is for podcast, it is essentially a centralized station where the podcast file is uploaded, and the platform and hosts, they go ahead and distribute it to all of the podcast apps. And it is also where we go ahead and pull our statistics. So essentially, a hosting platform provides a seamless experience for the listener. So now as we get into ACCME guidelines, again, I had mentioned we do disclosures and we mitigate everything for all the speakers. We do let the learners know about the status of disclosures as well as the credits. We do provide resources and a bibliography, and that is an A&A requirement for enduring. And each activity is good for 2 to 3 years. So this is an example of what's played for a podcast that had no relevant relationships.
Thank you for joining us for this episode of MedChat. Today's podcast has been approved for AMA, PRA Category 1 credits and ANCC credits. For complete accreditation information, the credit evaluation link, and contact information, visit the show notes. The planners and speakers of this episode do not have any relevant relationships to disclose. Again, thank you for joining us and enjoy the podcast.
That is an older introduction for that. We have since updated it, and it definitely does talk about the host as well, and we use the new terminology that was launched by ACCME. So just a disclaimer. So this is what the show notes look like. It's essentially a Word document that we send, and I'm going to highlight key points. So on our show notes, we have the evaluation and credit link first, and then you have the target audience and all of the detailed information. One thing for show notes is you are limited to 4,000 characters for Apple, so we're very careful on how we use that space. And I just pulled out some of the key things so you can see how we're disclosing the status of learner, moderator, and planner information, as well as commercial support. We do have the accreditation and designation statements. And if you see the times 0.75, one of the things that when it's being recorded, we'll track how much time it takes. So it can be anywhere from 30 minutes to 45 minutes. We don't tell the speaker that you have to stop at X time. We let the conversation evolve naturally, and then we'll go ahead and put the appropriate CME hours. We do provide the bibliography for study. And with the podcast, we have the date of the original release, and we do put the course termination date, and this is on all the show notes. So earlier I talked about how a lot of people, when they do listen to podcasts, are on the go. So what we do is we also have our podcast available on our website. And the value of this is we do hear from a lot of our providers that they kind of will batch listen, and then they'll go back to our website. And once you have clicked the more information, you will be able to either listen to it, read the brochure, or go ahead and claim credit. So the mission for Norton Healthcare is for us to provide continuing medical education that helps providers or improves providers' competency and or performance with the goal of improving patient outcomes. So this is some survey feedback for all of our podcasts that closed in 2023. So in summary, we feel we are meeting our mission with podcast. You can see 72% will make a change in practice, and this is some of their self-reported changes. And then these were some just general comments. And I went ahead and uploaded a summary of all the questions or the details that I have outlined for you as well. So those are some of the key steps for implementing a podcast, again, macro to micro. And if you have any questions, let me know. Thank you. There was a question asking if our MedChat is free or if there's a fee for the podcast. Our enduring activities, actually podcast as well as all of our enduring activities online, are all free. There is no fee for anyone to claim credit and participate in our program. And I think that is all the questions. No more so far, give it, okay. Well, if there's any additional questions on that handout, there is my email address. Feel free to reach out to me and I will be happy to answer any questions. And then let me share my screen real quick. And you can see the QR code to the podcast. And I am not live.
Karen, you do have a few more questions.
Okay. I've lost it for some reason. Can you read the questions to me? Did you say there was?
Sure, give me one sec. One of your questions is, does your human trafficking episode count towards your credit requirement?
For the state of Kentucky, we do not have a requirement for human trafficking. So we did not apply for mandated credits because that's not a requirement for us.
Okay, great. And the last question we'll have time for is, would you suggest keeping non-accredited and accredited separate, or is it okay to market accredited podcasts at all?
For our purposes, ours are accredited, and we do have different podcasts for Norton Healthcare. One is on strokes for patients. So what we've done is there's a channel in Apple of Norton Healthcare, and our other podcasts are there. So we do keep MedChat and the accredited podcast separate from the non-accredited podcast, though they're on the same channel for Norton Healthcare. Another thing we do is when the accreditation expires, we do now pull the podcast from our podcast hosts, so it is no longer live.
Okay, Karen, we're at time, but we have one last question. If you could answer it briefly, do you usually have support for your Enduring and podcasts?
Support as team support?
They didn't specify, but I'm guessing maybe some kind of financial support.
It's in the budget. Yes, we do have that. We probably spend about $4,000 to $5,000 a year for our podcast, and it is budgeted. In some cases, we did get commercial support when we did a substance abuse series.
Thanks so much, Karen, and we're at time. So,
all right. Well, thank you, and have a good day.